Hello, I'm Dr. Quietek.
Nice to meet you.
I have a scribe over here with me today. They're just going to be recording, not to worry about that. So I was looking at your chart. I see that you hurt your ankle. Can you tell me a little bit about what happened?
Well, I'm not normally so clumsy. I was walking down the stairs at my house. I need to go get my dog. And I was like almost there. I guess maybe I was rushing a little bit because he had to go outside and he's getting older. So I got to the last step and like, I don't know if I was going to jump off or something, but I kind of like took a big step and I missed the last one. And I landed weirdly on my right ankle, and like immediately afterwards I kind of just like could not put weight on it, and it really hurt.
So you were at the bottom step when this happened already?
Yeah, so I didn't like fall down this.
Okay, and when you injured yourself and you came down on this wrong, was that on the step? Was that on the bottom?
I might have actually.
Steps, or?
I think what happened is like I might have gotten the last step with my heel or something, and then like
it slid off from there and
yeah.
came down hard on it?
Yeah.
What was the surface at the bottom? Is that like hardwood floor, or was it?
Yeah, it was wood.
Wood? Okay. Do you have a history of any problems with this ankle before?
I played volleyball a lot, so there were a lot of rolling ankles in my past, and I have had like really small fractures in my ankle. Nothing like terrible that needs surgery.
How long ago would you say since you last had an injury to that side?
Like 3 years.
3 years ago. Okay. Did you ever have to have surgery on it?
No, just like tape and stuff.
Tape, okay.
Yeah.
And
then back out to the bottom.
what time did this happen?
I think 4 hours before I got here.
Okay.
Yeah.
Were you able to get up and walk on it at all?
A little bit, but then like as I kept walking on it, it got worse and worse. And
so you're limping on it now?
Yeah.
Do you have stuff at home from previous injuries, like braces or crutches or anything?
I do. I think I do. I need to look at it.
Okay. Is this hurting worse than you've ever had before? Or is this kind of like what you've had?
Well, I think it's kind of starting to swell. And like I put on my boots to help like stabilize it, but when I don't wear them, it really hurts to put weight on it. Okay. So yeah, it's worse than I've had in the past.
When you went down, did you hit your elbows or wrists or anything?
No, I was able to like stabilize. It's
just the ankle.
Just the ankle.
Okay. And do you have other medical problems? Are you on any medicines, not blood thinners, nothing like that?
No.
Did you take anything for it ahead of time for the pain?
No, I didn't actually.
Okay.
No.
So can you tell me where it's hurting you the worst?
It's kind of like just all the way around here area, like in, I guess, like the middle of my ankle.
Okay.
And like over to the side some.
Okay. Did you put ice on it or anything when it happened?
No. I really didn't do anything.
Okay. All right, that's fine. All right, I'm going to go ahead and examine you now.
Okay.
And it sounds like we just need to focus on your leg. Doesn't sound like you hurt anything else.
Yeah, no, I think I'm otherwise good.
All right, I'm going to start up here. Is there any tenderness here? No, not here.
No.
So there's no tenderness to the proximal fibula. This is all okay?
Yeah, that's good.
Okay. Now when I get down here, I'll go gentle, but you tell me where it hurts. Does that hurt here? Up here?
No.
How about out here?
Yeah.
That's worse than this side?
Yeah.
Swelling to the lateral malleolus with tenderness. No swelling medially, but some mild tenderness over the medial malleolus. And no obvious deformity. Okay. Tender out here?
Yeah.
It is? Okay. So there's some tenderness to the proximal fifth metatarsal. Dorsalis pedis pulse intact. Distal color, temperature, capillary refill, all normal. So you were kind of tender through there, and that's right where that ligament sort of pulls, and it took a little piece of bone off with it. So it's kind of like a sprain, but a little bit worse, but we want to get you some treatment for that, and you're going to have to follow up with an orthopedist. So we're going to have you in a brace that's called an air cast. So if we could put in for an air cast. And I don't want you putting any weight on it, so we'll get you a pair of crutches. And then I'm going to have my scribe put in a prescription for you for something for pain. If you could put in for a 15 Norco, would be great. And I want you to ice it and elevate it, and you'll get all of those instructions that the scribe will put in there for you.
Okay.
Do you have any questions?
I think I'm good.
Okay, very good.